I'm not filling this. You're just drug-seeking, and I can see right through it." The words echoed through the Walgreens pharmacy, loud enough that every customer in line turned to stare. Eric Palmer, 26 years old with 6 months of pharmacy assistant training and an inflated sense of authority, stood behind the counter holding a prescription like it was evidence in a criminal trial. David Richardson, 78, leaned heavily on his cane at the counter, his face tight with pain and now humiliation. Other customers shifted uncomfortably, some pulling out phones, others pretending not to notice the confrontation unfolding. David's hands trembled slightly, not from nervousness but from the chronic pain radiating through his spine. The same pain he'd lived with for 41 years since a helicopter fell from the sky with him inside it. If you believe our veterans deserve compassion for pain they earned serving us, type respect in the comments now. David had woken that morning at 5 a.m., the same time he'd woken every day since 1971 when military training rewired his internal clock permanently. The pain had been worse than usual, a deep grinding sensation in his lower back and legs that made walking from his bedroom to his kitchen an exercise in endurance. His small house on Maple Street was neat and sparse, the home of someone who'd learned to live with very little. His wife June had passed 7 years ago, and their daughter lived 3 states away with a family too busy to visit more than once a year. David lived on his military pension, supplemented by disability payments that barely covered his medications and the constant medical appointments at the VA hospital. At 78, he looked every year of his age and then some, his body worn down by injuries that had never properly healed, by surgeries that left more scar tissue than solution, by pain that never really stopped, but just varied in intensity. The prescription he had brought to Walgreens was for pain medication he'd been taking for over a decade, carefully managed by his VA physicians, regularly reviewed, never abused. David hated taking it, hated the way it made him feel slightly disconnected, hated the stigma that came with pain medication in an age of opioid, crisis hysteria. But without it, the pain was unbearable, made worse by the hardware in his spine from 23 different surgeries trying to repair damage that couldn't really be repaired. He'd tried everything else: physical therapy, injections, alternative treatments, meditation, acupuncture. Nothing worked well enough. The medication didn't eliminate the pain, just made it manageable enough that he could function, could grocery shop, could attend his weekly VA support group, could maintain some dignity and independence in his final years. Eric had been having a bad morning before David even walked in. His girlfriend had broken up with him via text. His car had a flat tire in the parking lot, and he'd been reprimanded by the pharmacy manager for being late twice that week. When David approached the counter with his prescription, Eric was already in a foul mood, looking for someone to exercise power over. He'd read articles about the opioid epidemic, had attended a single training session about prescription drug abuse, and had developed a conviction that he could spot drug seekers by appearance and behavior. When he saw David, elderly and shaky, with worn clothes and a cane, presenting a prescription for pain medication, Eric's confirmation bias kicked in immediately. This was exactly the kind of person the articles warned about. Older patients, chronic pain claims, opioid prescriptions. Red flags everywhere. "Sir, this prescription is for oxycodone. That's a controlled substance. I need to ask you some questions." Eric's voice was already accusatory before he'd asked anything. David nodded patiently. "Yes, I know. I've been taking it for years. My VA doctor prescribed it." Eric's eyes narrowed. "How long have you been on this medication?" David shifted his weight, the standing making his back worse. "About 12 years, carefully managed and monitored." Eric scoffed. 12 years? That's dependence. That's addiction. No legitimate doctor would prescribe opioids for 12 years. David's jaw tightened. "My doctor is legitimate. I have documentation. The pain is from combat injuries." Eric wasn't listening. He'd already made up his mind, and now he was performing for the audience of customers, proving his vigilance. "I'm sure that's what you tell every pharmacy," Eric said loudly. "But I'm trained to recognize drug-seeking behavior, and this fits the pattern. Elderly patient, chronic pain claims, controlled substances, probably doctor shopping." David's face flushed, not just from pain, but from anger and shame. "Young man, I've been coming to this pharmacy for 4 years. Check your records. Same prescription, same doctor, filled regularly and appropriately. I'm not drug-seeking. I am pain managing." His voice stayed quiet despite the emotion behind it, the discipline of decades of military bearing keeping him controlled even when he wanted to shout. Eric shook his head decisively. "I'm not filling this prescription. I'm exercising my professional judgment to refuse dispensing medication I believe is being misused. You'll need to find another pharmacy." He handed the prescription back across the counter like it was contaminated. The other customers in line were visibly uncomfortable now. An older woman behind David looked appalled. A middle-aged man whispered to his wife, "That's not right." A teenager was actively filming the confrontation. David stood there, holding his prescription, humiliation burning through him worse than the pain in his spine. This had happened before. Not often, but enough times that he recognized the pattern. People saw an old man with pain medication and assumed the worst. They didn't see the x-rays showing the metal rods in his spine, the surgical scars covering his back and legs, the medical records documenting injuries from a day in 1983 when a UH-60 Black Hawk helicopter experienced mechanical failure during operations in Grenada and fell 200 feet with him and 7 other soldiers inside. They didn't see Steel Richardson, decorated combat veteran, survivor of multiple deployments, 23 surgeries, and 4 decades of chronic pain. They just saw a drug seeker. Before David could respond, a voice cut through the pharmacy from near the waiting area. "Eric, what exactly is happening here?" Maria Sanchez, 42, had been sitting in the waiting area reviewing files while David's prescription was supposedly being filled. She was David's VA caseworker, had been for 3 years, and she knew his entire medical history. She'd accompanied him to the pharmacy that day because they'd had an appointment at the VA hospital earlier that morning, and she'd offered to help him with his errands afterward, knowing his mobility was limited. She stood up now, briefcase in hand, her expression shifting from confused to angry as she processed what she'd just heard. Eric looked at her dismissively. "This is pharmacy business, ma'am. Private patient matter." Maria walked directly to the counter. "This patient is my client. I'm his VA caseworker, so it's very much my business when I hear you accusing him of drug seeking." Eric crossed his arms defensively. "I'm just doing my job. This prescription raises red flags. Long-term opioid use, elderly patient, it's textbook drug-seeking behavior." Maria's eyes went cold. "Textbook? Let me show you what's actually textbook." She opened her briefcase and pulled out a thick file folder. "This is David Richardson's medical file. VA records, comprehensive and documented. Would you like to see what's inside before you continue making accusations?" Eric hesitated, his confidence wavering slightly, but his pride wouldn't let him back down. "I don't need to see records to know what I'm seeing." Maria opened the file anyway, spreading documents across the counter where Eric and the gathering crowd of customers could see. 23 combat-related surgeries over 41 years, spinal injuries from a helicopter crash during Operation Urgent Fury in Grenada, October 25, 1983. Multiple vertebrae, fractured, spinal cord compression, chronic nerve damage, hardware implanted in 6 separate procedures. She pulled out X-ray images, laying them on the counter. Even to untrained eyes, the hardware was visible, metal rods and screws holding David's spine together. He has titanium rods from L2 to S1, bilateral pedicle, screw fixation, and permanent nerve damage causing chronic pain syndrome. This isn't drug seeking. This is pain management for documented, verifiable, combat-related injuries. Eric's face went from confident to uncertain. Maria wasn't finished. She pulled out another document. Here's his physician's note from Dr. Richard Chen, Chief of Pain Management at the VA hospital. It details David's treatment plan, the conservative approach they've taken, the multiple alternatives they've tried, and the medical necessity of his current prescription. It also notes that David has never once failed a drug screening, never requested early refills, and never exhibited any behavior consistent with medication misuse. He's a model patient managing chronic pain from service-related injuries. The pharmacy had gone completely silent. Every customer was watching now, the teenage boy still filming, the older woman behind David with tears in her eyes. Eric stammered, I didn't know. He didn't tell me it was combat injuries. Maria's voice went sharp. He told you it was from combat injuries. You dismissed him. You made assumptions based on his age and appearance. And more critically, you violated HIPAA by loudly discussing his prescription and accusing him of drug seeking in front of other customers. That's a federal violation. Eric's face went pale. I was just trying to prevent prescription abuse. Maria shook her head. No, you were making judgments without information. You were profiling a patient, and you were humiliating a veteran who's given more to this country than you can possibly imagine. She turned to David, her expression softening. Mr. Richardson, I'm so sorry this happened. This is completely unacceptable. David had been standing quietly through Maria's intervention, his face a mask of controlled emotion. Now he spoke, his voice rough. It's all right, Maria. He's young. He doesn't understand. But Maria shook her head firmly. No, sir, it's not all right. This is discrimination. This is exactly the kind of treatment that makes veterans feel devalued. She looked around. Is the pharmacy manager here? A woman emerged from the back, late 40s, wearing a white coat with a name tag reading, Susan Walsh, Farm D, Manager. She'd been listening from the consultation room, had heard everything, and her face showed both anger and deep concern. I'm here. I heard the entire interaction. She walked directly to David. Mr. Richardson, I'm profoundly sorry. This should never have happened. Eric, go to my office. Now. Eric tried to protest. But I was following protocol about controlled substances. Susan cut him off. You are not following protocol. Protocol requires reviewing patient history, consulting with prescribing physicians when appropriate, and treating patients with respect. You did none of those things. You made assumptions, violated HIPAA by discussing this loudly in public, and humiliated a patient with legitimate medical needs. Office. Now. Eric's face burned red with shame and anger, but he walked to the back. Susan turned to David. Sir, let me personally fill this prescription. It'll take just a few minutes. And please have a seat. I'll bring it to you. When it's ready, no charge. David shook his head. Ma'am, I can pay. Susan's expression was firm but kind. I know you can, sir. But please accept this as an apology. It's the least we can do. While Susan worked on the prescription, Maria helped David to a chair in the waiting area. Other customers approached, several apologizing for what they'd witnessed, others thanking David for his service. The older woman who'd been behind him in line sat next to him. My husband was in Vietnam. He dealt with pain for years after he came home. People never understood. I just want you to know I see you, and I'm sorry that boy was so cruel. David nodded, not trusting his voice. The teenager who'd been filming approached hesitantly. Sir, I recorded what happened. Do you want me to delete it, or... people should know about this. David looked at Maria, who said gently, That's up to Mr. Richardson. David thought for a moment. Keep it if you want. Maybe it'll help someone understand. 20 minutes later, Susan emerged with the prescription, personally handing it to David along with a printed sheet. Mr. Richardson, Here's your medication and a direct line to me. If you ever have any issues at any Walgreens anywhere, call me immediately. I've also flagged your account with a note about your medical history and VA status, so this never happens again." David took the medication and the paper. "Thank you, ma'am." Susan wasn't done. "I want you to know that Eric has been terminated. This wasn't a minor error in judgment. He violated federal privacy laws, demonstrated discrimination, and showed a fundamental lack of compassion that's incompatible with healthcare work. I take full responsibility for not training him better, and that's going to change." She looked at Maria. "Can I ask what VA resources exist for training pharmacy staff about veteran healthcare needs?" Maria's expression shifted from angry to impressed. "Actually, yes. The VA has training modules specifically designed for civilian pharmacies. They cover common service-related conditions, appropriate pain management for combat injuries, PTSD medication needs, and how to respectfully serve veteran populations." Susan pulled out her phone. "Can you send me that information? I want to implement it immediately. Not just here, but I'll push for company-wide adoption." Maria nodded. "I'll send it today. This could actually become something positive, better training across the system." Susan looked back at David. "Sir, would you be willing to participate in that training? Not to relive trauma, but maybe to help pharmacy staff understand the reality of veteran healthcare needs?" David considered, then nodded slowly. "If it helps others avoid this, yes." Over the following months, David's story became the catalyst for significant changes at Walgreens and eventually across multiple pharmacy chains. The teenager's video went viral, viewed millions of times, sparking national conversation about how veterans with chronic pain were treated in civilian healthcare settings. The outcry was intense, with veteran advocacy groups using the footage in campaigns about dignity and appropriate care. Susan Walsh worked with Maria and the VA to develop comprehensive training modules that became mandatory for all Walgreens pharmacy staff nationwide. The training included David's story, his medical documentation, and his personal testimony recorded specifically for educational purposes. He spoke about the helicopter crash, the decades of surgeries, the reality of living with chronic pain, and the additional trauma of being accused of drug seeking when seeking legitimate medical care. Eric Palmer never worked in pharmacy again. The HIPAA violation and discrimination firing made him unhireable in healthcare. He posted an apology video online that felt defensive and incomplete, blaming lack of training rather than accepting full responsibility for his judgment and cruelty. The internet was unforgiving. Some people argued he deserved a second chance, that he was young and could learn. Others pointed out that working in healthcare required baseline empathy and respect that Eric had demonstrated he lacked. The video of the confrontation followed him, making job hunting difficult across industries. He eventually moved to another state, took a job in tech support, and hopefully learned something about assumptions and humility, though there was no way to be certain. The pharmacy where the incident occurred placed a small plaque near the prescription counter. "Every patient deserves dignity, respect, and compassionate care. We serve everyone, especially those who've served us." Maria Sanchez was promoted within the VA to Regional Director of Veteran Advocacy, in part because of how she'd handled David's situation and her work developing the pharmacy training program. She continued working with civilian healthcare providers to improve veteran care, using David's case as the foundation for broader systemic changes. The training program they developed was adopted by CVS, Rite Aid, and eventually most major pharmacy chains, reaching thousands of pharmacy staff members. Studies showed measurable improvement in how veterans were treated, fewer complaints, better communication, more respectful interactions. David became an unexpected advocate, speaking at pharmacy conferences, participating in training videos, and working with Maria to educate healthcare providers. He did it reluctantly, uncomfortable with attention, but driven by the belief that his humiliation could prevent others from experiencing the same. The Walgreens where the incident occurred became known as veteran-friendly, with staff specifically trained in military-related healthcare needs. Veterans started choosing that location specifically, knowing they'd be treated with understanding. Susan Walsh built relationships with local VA facilities, creating a pipeline for veteran patients to receive coordinated care. She hired several veterans as pharmacy staff, including a former Army medic who understood combat injuries from personal experience. The culture of the pharmacy changed fundamentally, becoming a place where service was honored and pain was treated with compassion rather than suspicion. David continued filling his prescriptions there, and over time the staff came to know him not as the man from the viral video, but as Mr. Richardson, the quiet veteran who always said thank you, who asked about their families, who embodied dignity despite chronic pain. David lived 6 more years after the incident, years marked by continued pain but also by purpose. His work with the pharmacy training program gave him meaning, a way to turn his humiliation into positive change. His daughter visited more often after seeing the viral video, finally understanding the pain her father had lived with silently for decades. She brought his grandchildren, who learned about their grandfather's service and his advocacy work. David's small house filled with letters from veterans thanking him for speaking up, for making their pharmacy experiences better, for giving voice to a problem many had suffered in silence. When he passed at 84, peacefully with his daughter holding his hand, his obituary mentioned both his military service and his civilian advocacy. Susan Walsh attended the funeral, as did Maria, as did several pharmacy staff members who'd been trained using his story. The video of Eric's confrontation and Susan's intervention became required viewing in pharmacy schools across the country, taught alongside HIPAA regulations and patient rights. Students learned about implicit bias, about making assumptions based on age and appearance, about the reality that many people living with chronic pain earned that pain serving their country. They learned that behind every prescription was a complete human being with a history, that dignity cost nothing but meant everything, and that healthcare required treating patients with respect, especially when their conditions made them vulnerable. David's X-rays, anonymized but clearly showing the extensive hardware in his spine, became teaching images about combat injuries and chronic pain management. His story was cited in medical journals, in veteran advocacy reports, in congressional testimony about improving veteran healthcare access. The systemic changes sparked by one pharmacy assistant's cruelty and one caseworker's intervention rippled across American healthcare. Thousands of veterans reported better treatment at pharmacies, fewer accusations of drug seeking, more understanding of service-related conditions. Pharmacy chains implemented veteran identification in their systems, not to single them out, but to ensure staff understood the context of their healthcare needs. The VA expanded its civilian pharmacy training program, reaching not just pharmacies but also emergency rooms, urgent care centers, and primary care offices. David's humiliation became a turning point, proof that individual incidents of discrimination could spark systemic reform when witnessed, documented, and acted upon with courage. If you believe every veteran deserves compassionate health care without judgment, if you believe chronic pain from service-related injuries should be treated with respect, not suspicion, subscribe to my channel. Share this story so people remember that behind every prescription is a person, that assumptions about drug seeking can re-victimize those already suffering, and that sometimes the most powerful thing we can do is stand up for dignity when we witness cruelty, creating change that echoes far beyond a single moment in a single pharmacy.